Welcome back, everyone, and thank you for joining. My name is Dave. I'm with Lifetech Instructional out of Palm Harbor, Florida. We're going to be doing infant choking. Now, in our previous videos, you already learned the introduction to CPR, why we do CPR. We did adult CPR, child CPR, infant CPR. We did adult choking and child choking. Now we're going to do the infant side of it. Now, infant is considered newborn up to 1 year of age. If an infant is silent, unable to make any sounds, and turning blue, you have to act fast. Yes, shout for help, call 911, get the help that you need. Now, you want to take that infant and you want to sit down on a chair or you kneel to the ground. You want to place that infant face down, resting on your forearm. You see, your arm next to something hard, but you also want to make sure you have good support. Now, your hand is either going to do a V shape, you're able to support their head, or you can take your thumb and your other part of your other forehand to support their head. Because remember, small little babies have little weeble wobble heads. So you got to support that baby's head. But you also want to place that infant over your leg or your legs for support. Because in reality, if you see these babies out there today, there's some small ones, but a lot of them, there's some big babies out there. But keep in mind, each and every one of you have different arm lengths and strength. So get as low as you can, either sit down on a chair, get to the ground, place that infant over your leg and legs for support so that you have good control of that infant. You want to make gravity work with you, so you want to slightly tilt the infant downward. Now, you take the heel of your other hand, this part right there, and in between the infant's shoulder blades, you are going to provide 5 back slaps. 1, 2, 3, 4, and 5. When you do those 5 back slaps, now we got to do 5 compressions. What we do is you take your other forearm and place it on the infant's back with your hand supporting the back of their head. You turn that infant as a unit onto their back. Place on your leg or legs for support and slightly tilt infant downward. Take your 2 fingers, just like in the previous video, we showed you how to do infant CPR. So you're using 2 fingers only, a finger width just below the nipple line, and provide 5 compressions. 1, 2, 3, 4, and 5. After 5 compressions, continue providing the 5 back slaps. 2, 3, 4, and 5, followed by the 5 chest compressions, and continue until the object hopefully expels out. That's the goal that we're trying to achieve in doing that. If the object expels out, that is great. The baby should have little silent cries, maybe baby will start coughing again, and baby comes responsive. But the downside is, you did everything you can to get the object to expel out, but it doesn't expel out. Then yes, baby goes unresponsive. Place the baby on a firm, flat surface. Look in the infant's mouth for an object. Now, infants' mouths are small. Their tongues are very big in their mouth. The only thing, as you look, if you can see the object, the only thing you'll be able to use is your pinky finger to get in the infant's mouth to do a sweep. A pinky sweep to see if you can see the object. Don't stick your fingers in the mouth. If you don't see it, no blind finger sweeps. Don't stick your fingers in there. If you don't see anything, then you're going to start your CPR. As you're doing your CPR, you are going to provide 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now, the reason why we're doing those compressions is because when the infant's on their back, sometimes their chest expands a little bit. And by doing my compressions, I'm not just circulating blood and oxygen into that baby's brain, but I'm also able to put some pressure on the infant's lungs too, on the chest. And so by doing that, sometimes it's able to get the object to pop out in the infant's mouth. So after your compressions, 27, 28, 29, 30, look in the infant's mouth. If you can see it, remove it. If not, don't stick your fingers in the mouth. Now you need to provide your breathing. You got to provide some puffs of air. Now, if you give your puff of air, which goes over the nose and mouth, you should be able to see the infant's chest rise. If air goes in, that is great. Hopefully the infant starts to respond by giving them a couple breaths from there. But if air doesn't go in, you might have to do still maybe just another slight head tilt to lift, just a sniffing position only. Tempt your puff of air again. If air does not go in, then don't force the air. You're just going to go right back and doing your compressions of 30 compressions, pushing down about 1.5 inches on the infant's chest. And after those compressions, look in the infant's mouth again for an object. So continue providing CPR procedures until EMS gets on scene. If the infant does to respond by coughing, vomiting, any secretions coming out of the mouth, yes, place the infant on the left side, supporting their head to help protect their airway. One thing I'm going to throw in addition, and we're going to throw a child in this also. You see, infants and children like to stick things in their mouth, don't they? It's more respiratory compared to more cardiac. So it's not wrong for you to check that infant or child's mouth first before doing any procedures, as long as you're not wasting so many seconds doing that. Okay? And like I said, if you can see it, remove it, but no blind finger sweeps. That is infant choking. Thank you very much.